Hello, everyone. My name is Camille. Again, I'm with the Student Nurses Association, and together with the Virtual Student Center, we are presenting information on diabetes awareness for November, the Diabetes Awareness Month. And we're just here to give you some information so that you can take it forward in your life and help yourself and others around you. So the one thing that you need to know before beginning to learn about diabetes is the pancreas. Diabetes involves the pancreas very intimately. The pancreas does aid in digestion of all foods, and it does this along with the gallbladder and the liver in the body. So it excretes what we call digestive juices along with those two other organs to help you digest any kinds of foods you're eating. On top of that, the pancreas also produces two hormones, insulin and glucagon. And these are produced by beta cells in the pancreas. Insulin helps break down glucose into something more usable for the body and for your cells. And glucagon encourages the breakdown of glycogen into glucose. And that's a process that happens in the liver. So it'll pump out glucagon to the body and encourage the liver to break down glycogen into usable glucose. And diabetes is defined as a variable disorder of carbohydrate metabolism caused by a combination of hereditary and environmental factors. And that is the Merriam-Webster definition of diabetes. Essentially what it is your body can't figure out what to do with all of the glucose it has in its body. Either it's an insulin, well, it's most likely going to be an insulin problem. There are three different kinds of diabetes that we're going to be talking about today: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is previously called insulin-dependent or juvenile diabetes. And this is usually because it presents in young children, teens, and young adults more often than anyone else. It can present later on in life, but typically that's when it will present. It is thought to be caused by an autoimmune disease that will attack those beta cells that I talked about earlier. But some people have it genetically, are genetically predisposed to it through their parents and end up not getting it at all, whereas others have it and end up catching this disease. Most of the research nowadays is thinking that you need to be genetically predisposed on top of being exposed to another kind of illness that they can't quite track down yet. There's still bunches of research being done on type 1 diabetes. But essentially, the body can no longer make those, the insulin hormone, which causes high blood sugar. And that's, like I said, due to damage to the beta cells of the pancreas. Type 2 diabetes is also called insulin-resistant diabetes. It typically manifests around the age of 45, but it can manifest a whole lot earlier. And we are seeing it manifest earlier and earlier in today's society due to many different lifestyle changes that are going on. Insulin is around in the body, but the body just ignores it. It doesn't respond to it the same way it used to because it's overly exposed to the insulin. And then the glucose levels will increase because the insulin's not being used. And when the glucose levels increase, you have an overload, essentially, and a deficit of insulin that you need. This is the most common type of diabetes. In all diabetes cases, it's about 80 to 90% of what you would find. And the risk factors include living a sedentary lifestyle, being overweight, having a family history of type 2 diabetes, and having gestational diabetes in the past. This also occurs more in men than in women, so guys need to be looking out for it, especially, and doubly especially, if you have a family history of it. Gestational diabetes is a type of diabetes that occurs during pregnancy. In pregnancy, your body is just overloaded with all kinds of different hormones, and insulin can sometimes just get lost in the mix up there. And it's dangerous for mothers and babies, especially since the mother might not be used to having to regulate carbs and check the blood sugar or delivering their own medications. It is definitely something that requires a significant amount of monitoring. It is possible for a mother who is pregnant to go into diabetic shock, and they would need treatment almost immediately. And the complications from this include having rather large babies when they're born, needing a C-section, preeclampsia, which is also known as high blood pressure, and a preterm birth could occur because of this as well. Now, testing to see if you have diabetes can be done at home, but in order to confirm the diagnosis, you need 2 separate doctor's appointments in which your blood sugar numbers are altered. Blood sugar numbers are usually between 70 and 140 milligrams per deciliter when you're doing the blood sugar readings. And if you see something that's off from that, there might be a little bit of a problem. And it's something you want to look more into. In order to test your blood sugar, the first thing you need to do is grab one of the little monitoring devices like you see up in the photo in the left-hand corner. You're going to need to prick your finger with a little needle that is given to you with your diabetes kit. Place the blood on the test strip that it will also be in your diabetes kit. Allow it a few seconds to read the results, and you should be able to find out very quickly what your blood sugar number is at. Typically, it's taken on the side of the finger rather than the pad of the finger, because the pad of your finger has a significant amount of nerve endings. So you want to take it along the side of your finger instead to keep the pain down a little bit. I have seen in clinical settings where blood sugar will be taken from the upper ear, or in some instances from the toes when the fingers are not available or it's just not working. The one thing that you need to make sure of when you're taking the blood sugar is that there are a significant amount of capillary beds or little teeny tiny veins. So you want to make sure that that is what you're getting at when you do a blood sugar test. So doing it in the leg might not work as well. You want to make sure that you're getting somewhere that's got a lot of those little tiny veins, which unfortunately is in more sensitive areas. Patients are given typically a sliding scale, their own personal sliding scale, that'll say something along the lines of, if your blood glucose is measuring at 200 milligrams per deciliter, give X amount of units of insulin. Or if your glucose is measuring at 60 milligrams per deciliter, take a glucagon tablet. And I will let Ms. Hillary take over from here.
Okay, my name's Hillary. I'm also a part of the Student Nurse Association. And Camille, I just realized you're gonna have to flip the slides for me. I just realized that. So two of the biggest complications of diabetes is hyperglycemia and hypoglycemia. And the way I always remembered which is that hypo sounds like low. So that means it's a low blood glucose level, and hyper would be a high blood glucose level. And so hyperglycemia can be caused by the body has too little insulin and too much glucose, which is usually the case in type 1 diabetes. So the pancreas is not producing the insulin and you have a high blood glucose level. Or in type 2 diabetes, the body does have enough insulin, but it's not using it effectively, like Camille said previously. So the glucose level remains high. Flip it. So what causes hyperglycemia? There's a number of causes. Some of the most common could be you ate more than you had plans on. Maybe Thanksgiving, we all ate a big meal. I know I did. Sometimes it can be actually be caused by an illness, such as the flu, or if you had COVID. So stress from school, work, your family life, etc., can make your glucose levels rise as well. There's another thing called the dawn phenomenon, where in the early mornings around 4 o'clock, if you're on a normal sleep cycle, there is a surge of hormones in the body, which can cause your glucose to rise in the middle of the night. And then so hyperglycemia has a lot of signs and symptoms as well as hypoglycemia. Some of the early signs that you would see is going to be an increase in thirst. And then you'll also, associated with that, have a frequent urination as well. A lot of times people notice this during the evening, like at night, they're waking up in the middle of the night and having to use the bathroom often, waking up with a dry mouth and super thirsty. You also will have fatigue, maybe a headache, maybe a little blurred vision. Some of the later signs, if the blood glucose is not controlled, you'll see nausea, vomiting, abdominal pain. You might get shortness of breath, the dry mouth, like weakness, confusion. One of the biggest signs and symptoms of hyperglycemia is the fruity smelling of the breath. A lot of people say it smells like almost like an fruity acetone scent as well. And then if it progresses even more, the patient could slip into a coma. And then you have like a big medical emergency on your hands. So the treatment for hyperglycemia, the biggest thing is you want to monitor your blood glucose levels frequently, just so you don't progress to an emergency situation. We have some. Okay. You could also control it by exercise. But once again, you want to make sure that you are checking your sugar before you exercise. This says unless ketones are present in the urine, because that can increase the glucose as well if you exercise on top of that. So patients are going to want to check the ketone levels in their urine as well. Make sure you're taking your medication as directed. Adjust, like Camille said, adjust your insulin if needed with that sliding scale. And even on sick days, when you're not eating much, you still want to make sure you're taking your medications as directed. So even when you're sick and nausea, vomiting, try to take those medications as directed. Also, stick to the diet that is planned between you and your healthcare provider. Avoid the sugary drinks and the sugary snacks and candies, because that will also raise the blood glucose levels. So here's hypoglycemia, low blood sugar. This is usually a blood sugar below 70. Sometimes people, they can have that 70 level and not have any signs and symptoms. So this would be if you, a type 1 diabetic, if they administer too much insulin, then it can drop their blood glucose levels. And then when you take your type 2 diabetes, taking your medication when your blood glucose level is already low as well, can increase that insulin level and drop the blood glucose even further. So signs and symptoms, these patients are going to start to get agitated and irritable. They might be nervous and anxious, dizzy and lightheaded. They're going to be sweating or having like clammy skin where it's kind of cool and moist. They might be pale in the face, have tachycardia. They might be confused, fatigue, weakness, nausea, hunger, blurred vision. This confusion, when the levels get really, really low, the patients, I've seen patients with a blood sugar of 23.
Wow. And
they've been sitting up talking to me, but they don't know what's going on. Whereas I've seen other patients with a blood sugar of, low 20s, and they're completely unconscious. So it depends on the patient, but that is definitely a medical emergency and that needs to be taken care of immediately. So, yeah, I can't. Okay. So like I said, the treatment for hypoglycemia, this is like instant glucose right here, this picture. It's like a little tube and all it is like sugary gel, just a clear sugary gel. And this can, if the patient is still conscious, you can administer this. Where if they can swallow, if they cannot, do not put anything in their mouth. This is going to have to be given intravenously if they cannot swallow. So if the patient's like starting to get those early signs of hypoglycemia, they need to check their blood sugar, and then they can either maybe drink 4 ounces of orange juice, maybe a little bit of soda, or make sure they have hard candies on hand as well, because that's a good way to get that blood sugar up. Was that the last
I believe that is our last slide here. The one thing that I think we wanted to hit home is if you're having this kind of situation with any kinds of those symptoms, the first and foremost thing you want to do is test your blood glucose levels. Because the last thing you want to do is take some of that instant glucose and you're not hypoglycemic, you're hyperglycemic, and then you've given yourself a worse emergency situation. So before taking or doing anything, test your blood glucose levels. If you're trying to help a friend, before you try to give them anything, test their levels. Testing is very important to this kind of situation. And after medication has been administered, you should test yourself again or test your friend again, depending on what you are, what the situation is.
And then another thing for the hypoglycemia, if you do experience this and then you take a oral glucose gel or a hard candy or soda or juice, it's going to get that blood sugar up pretty, fairly quickly. Now you will want to make sure that you have a snack after that to maintain that glucose higher level, because if not, it's just going to bottom right back out again. So you want to do something that's going to have a little bit of carb and protein. I always suggest maybe a peanut butter sandwich, and then that's going to help maintain that glucose level.
And with that, I think we will turn it over to Chuck, and we will be answering questions at the end of our session here.
Hey, everybody. Let me start off by saying this. You know, you go to the AA meetings and they say, my name is Chuck and I'm an alcoholic. My name is Chuck and I'm a diabetic. And what I have done is I do that so I can teach my family. When I talk to my family on the phone for Thanksgiving and stuff like that, I talk to them about my diabetes and let them know that we have the potential, my family does, because my mother's been a diabetic for 50 years. And she's been a lifelong diabetic. And me being a fitness and recreation person, I thought I had beat it. I'm 59 years old. I just got diagnosed about 2 months ago. So I thought I was out of the clear. But when I stood up one day, and now that I think back about it, I would get up in the morning and I would feel dizzy. I'd have blurred vision. I remember driving to work one day, and I felt like I had to pull over because I was getting ready to pass out. But I kept the car in the road. I got to work. I sat in my car for a little bit and got myself together and then came to work anyway. And those things have started happening for me probably over a 2 or 3 year period. But being a health guy and knowing my body, I knew something was wrong, but I just didn't think it was diabetes. So once I got up that one morning, and I just felt like I couldn't stand up. I felt like my balance was off. I felt jittery. My vision was really blurred. I couldn't even see the TV. I was watching the morning news and I couldn't see the TV. And immediately I just told my wife that I feel like something was wrong and we had to go, to the hospital and go see my doctor. I didn't go right away and I should have. But what I did is I called my doctor and he gave me an appointment early that morning. So when I got in his office, and he had seen me plenty of times before, but I've never complained to him about the blurred vision and the diabetes symptoms. So when he finally took my A1C, and this is over a 3-month period, my A1C was 11.1. That's pretty high. It's pretty high. He told me to have a seat. He called the nurse in and told her to get a wheelchair because he said I was going to the emergency room. I was like in shock. I could not believe that I had to go to the emergency room. I tried to bargain with him, see if he could take it down in the office and do all of that. But once he explained it to me and I realized what was happening, I had ketoacidosis. It's a quick onset. It just happened all of a sudden. So once we went there, we went to the emergency room. I got in the emergency room. They brought it down. They brought my A1C down. And then from there, I went to the pharmacy. I went from taking no medication to taking metformin, blood pressure medication, cholesterol medication, and insulin. That was a shock. And I wasn't taking any meds. So that kind of like threw me off. I started to get in this little state of depression, maybe feeling like, wow, I got to start taking all this med. And I've seen people do it before. I just didn't think it was for me. But little did I know, a lot of these symptoms were going on and I just didn't realize it. The average normal A1C is 5.7. Mine was 11.1. My fasting blood sugar, when I got up that morning, a regular fasting blood sugar is between 70 and 99. Mine was 400. That was terrible. Almost to the point where, I think my doctor said, he said, you're like the Walking Dead. We were just kind of like having some fun with it, but he said you were like the Walking Dead. So that lets you know how high it was that morning. And when I got up that morning and being at 400, now that I know about it, I see why I was dizzy. I see why I was jittery. I see why I couldn't drive to work and hold my car in the road. When I called and talked to my mom told me about it. I was a little depressed. I was feeling bad, and then, she made a good point. She told me, she said, Chuck, she said, well, you didn't go to the doctor and he gave you a diagnosis that you can't do anything about. She said, you take your medicine, you educate yourself about it, you try and find out what's going on and you manage it. She said, I've been doing this for years. And when she told me that, it got me in gear and I was like, okay, maybe I can manage this thing. I started watching everything, documentaries. I went to a nutritionist that my doctor set me up with, and along with some of the things that I was doing on my own, trying to educate myself. But what I did one time, I was watching a documentary and it talked about, I had considered becoming a vegetarian. And what I did is I became a vegetarian for about maybe about 2 months. And what happened and what made me do it, I was watching the documentary and we were looking at being a vegetarian, and it talked about a gorilla. A gorilla eats plants, and you see how big and strong they were. So that kind of convinced me that I can probably get the energy and get the power that I needed to continue to kind of like move on without eating the meat and all that good stuff. And then it also talked about an elephant, how big an elephant was, and he was a vegetarian. He didn't eat meat, so I kind of like got on his bandwagon. I said I can do this vegetarian thing. And then me and my wife, we changed everything in the house. We went through the refrigerator. We took out things that we found out that wasn't good for me. We took out some of the sugars. I was already allergic to nuts and sesame and soy. So that kind of eliminated a lot of things for me right off the bat. But once we started finding out the whole grains and the whole foods that we can get and started stocking the refrigerator, start making our own meals, that was the kicker. It's just me and my wife. So we were used to eating out a lot. And then when you're eating out, you don't know how much butter and you don't know what the seasonings are. So so we stopped eating out. That saved some money right off the bat. So I was grateful for that one. And then and then we started cooking our own meals and we manned up on it, man. And when I went back to my doctor after 3 months, I was at 11.1. I was at a 5.9. He told me, he said, out of all the years he was doing medicine, He said that we were in his top 5 for getting a diagnosis 3 months and then coming back 3 months later and having a 5.9. So I felt good about that. You know what I mean? So, that was a good thing. But, some of the symptoms that I had, man, and as I think about it now, probably 2 to 3 years earlier, I was feeling tired and low energy. And I'm a fitness guy. I always had this energy to do what I wanted. One day I fell asleep at work. I can't tell nobody, but I'm telling you all now, I was in my office and I had to lay in my chair and go to sleep for a minute. I just couldn't stay awake. And I thought that was so odd. And I just thought maybe I wasn't getting enough sleep and all this good stuff. My hunger, just like you talked about earlier, and thirst, my blurred vision, my slow healing of sores. I had sores on my body sometimes from getting a cut. I was redoing the bathroom in my house, and I cut myself on a nail, and it just wouldn't heal. And I was like, wow, this was different. And then, you know what I mean? And then at night, I would get up 4 or 5 times a night, couldn't get a good night's sleep. I felt, and that's why probably I was tired most of the day, but I was getting up 4 and 5 times going to the bathroom. Ketoacidosis was setting in on me. And, and I wasn't familiar with this, with this happening to my body. You know what I mean? And then the classic symptom, and this is the thing that I felt first, the numbing and tingling in my hands and feet and my nerve endings. That started first now that I think about it, and that gave me my first sign. And if I would have known what I know now, I probably would have gone to the doctor and start getting things checked out right away. Some of the preventative advice I can give you: meet with a nutrition. You meet with a nutritionist, man. They give you they give you a good plan to work with. You can take that plan, you can take it, incorporate it into your life. Maybe not everything works for you, but a lot of it did work for us. I became a vegetarian for 2 months. I told you that, but I'm eating meat again. I didn't stop eating meat. I became a vegetarian so I could get my numbers down. You know what else I did? I joined a diabetic forum on Facebook, and they talked about, they would always have these meal ideals and all these other things that they talked about. So I learned a lot from there. Everything doesn't work for everybody, but I was able to pick out some things that kind of like helped me. I started taking my meds. I wasn't used to taking meds. So, I had to go get one of those boxes with Monday, Tuesday, Wednesday, Thursday, Friday, and I had put that beside my bed. I've seen those for years. I was like, wow, I didn't know I would have one, but I got one beside my bed now, and I take my meds religiously. And then I work out twice a day. I can tell you like this: I got up this morning and my blood sugar was a little high, but it was about 260 because it was Thanksgiving. I was eating potato pies, eating all kinds of stuff, man. I was enjoying myself. But when I got up, my blood sugar was high. I took my insulin, I took my medicine, and then I went to the rec center. I went to the rec center and got in the pool and I do deep water jogging and the cardio. When I came back home, my numbers were like at one. I think this morning when I came at 142. So it almost had dropped like 100 points, from the time I went to the gym and got back. And then I ate. I just took it recently, and now I'm stabilizing at 128. Which is good for me now. I just had a snack, that I just ate. And then let me tell you this: what my wife did is she put me on she put alarms in my phone so I could eat my breakfast, eat a snack, eat lunch, eat another snack, eat in the afternoon. And that helped so much. And now that I'm feeding it and my body's eating on a regular basis and stuff like that, that helps a lot. I didn't know how much that would help, but that helped so much. I'm able to maintain, my blood sugar throughout the day. And I feel pretty good. I feel good today. If you would have asked me that about a year or so ago, I felt terrible. I didn't know what. I just thought maybe I was 59, I was getting older. But, I feel excellent. I got my energy back. My vision is much better. You know what I mean? I can concentrate. My energy level is high. I feel awesome. I can tell you like this: if you know anybody that has it, share the information that so that you can help them. A lot of people kind of like, they don't want to, they don't want to be bothered with it, or they kind of ignore the fact that they have these symptoms. But man, if you can share this information with family members, like I've done with my family members, and let me tell you this: one of my sisters, she found out that she has it, all from the conversation that we've had when we talked about, me being a diabetic and our mother being a diabetic. So, that hereditary thing is true. I feel good. I am trying to get off of the insulin, and my doc told me if I come back and my numbers are in good shape, He said he'll start with the insulin and start taking me off of some of my meds. So I'm on my way, you know, and, you know, I feel good. I feel excellent. So.
Thank you very much, Chuck.
Camille, I think you're still muted.
Sorry, usually when I push the space bar, it unmutes me. So thank you very much, Chuck. I think Mr. Roberts coming up next to talk to us about what we can do as far as our health promotion.
Yeah, hi everybody. So as Camille said, my name is Robert Barber. I'm the Fitness and Recreation Coordinator for the Norfolk TCC Student Center. And I'm gonna talk to you guys a little bit about how exercise affects diabetes. Little background from me, my dad's had it for a couple of decades now, so I've developed multiple plans for him and just kind of gone back and forth trying to help him lose that weight so that he can manage his illness a little bit better. So I'm gonna share screen real quick. Perfect. All right. Maybe. Can everybody see that?
Yes.
Perfect. All right. So again, we're going to be talking about how exercise affects diabetes today, and how you can improve and manage your disease through movement. So everybody knows about exercise, but I want to be clear on something because this is a discussion that I have with my father all the time. What is exercise? My father says, oh, I exercise all the time. I go out and I work on in the backyard and I do this in the deck. And yes, you're burning calories, and I'm sure at some time you're increasing your heart rate, but exercise should be activity requiring physical effort carried out to sustain and improve health and fitness. The difference between those is one, you're setting out strictly to improve your health. The other is that you are burning calories and you're adding movement through an activity that is directed at something else. All right, so the benefits of exercise on the body. This is just basic benefits for anyone and everyone who starts with or joins a exercise regimen. And I'm sure that most of you guys know all these, but it's going to affect the body through weight loss or maintaining your weight. It's going to improve your mood. Again, we talk about all of those chemicals within the brain that release through exercise. It's going to make you feel better. It's going to increase your energy. You know, Chuck talked a little bit about his difficulty sleeping. Exercise is going to help you sleep better. It's going to calm the body and calm the mind. It's going to increase your self-esteem. You'll begin to feel better about yourself. It's going to lower stress, anxiety, boredom, frustration, and depression. And ultimately, if there's any reason why you should exercise, I think that's probably number one, especially with what we're all dealing with right now. But when you start getting to the medical benefits of it, it's going to improve your blood pressure. It's going to improve your cholesterol. It's going to increase bone density. As we age, I want to say it's after the age of 25, we start to lose bone density and muscle mass at a more rapid rate. So through resistance training and exercise, you can actually increase that bone density and help fight off osteoporosis as you get older. It's also going to improve that memory, which will lead to a reduced risk of Alzheimer's. And it's going to lower that risk of heart disease and cancer. All right, so moving on, how does exercise affect diabetes? Well, there's three ways. Exercising regularly increase, oops, we're gonna see if we can go back here, which we cannot, hold on, sorry about that. All right. Exercising regularly increases your body's sensitivity to insulin, and it helps your body manage your illness. It helps lower and control blood sugar levels, lowering your risk of heart disease, kidney disease, and nerve damage. And when you weigh less, your pancreas is better able to keep up with your body's need for insulin. And in some cases, as Chuck's talked about, weight loss is enough to restore blood sugar to a normal level, which eliminates diabetes, which anyone who has diabetes, everyone's doctor has told them at one point, you need to lose the weight. And that's the reason you want to get back down to the position where your body can stabilize and produce and maintain those levels of insulin on its own without you having to manually take it. All right, so the two types of exercise that you really want to focus on, there's two. There's aerobic exercise or cardiovascular exercise. And this is done using your arms and your legs, continuously rhythmic movements in order to increase your heart rate. So getting that blood flow going, getting that heart rate up. And that's going to help you lower your blood sugar levels. Now, on the other end, we have strength training. And this is exercise done by using your body weight, weights in the gym to increase muscle strength, muscle tone, and muscle endurance. However, strength training is going to increase your blood sugar levels. And the reason being is because the main food source for muscle use is sugars, right? So as you are exercising, you're burning those sugars out. Your body says, okay, well, we need to replenish so that we're not breaking down the muscle even more and absorbing what we've just done. So let's increase those sugar levels within the body. So you actually, when Chuck talked about it, you know, taking your blood sugar levels before and after to really see how this exercise affects your body, you will see those definite increase and decrease based off of the type of exercise that you are performing for the day. When we talk about examples, aerobic, you're looking at running, walking, swimming, biking, dancing, hiking, anything that's going to incorporate movement and increased heart rate. When we talk strength training, we're talking about going to the gym using circuit machines, free weights. You can do body weight resistance at home. You can utilize, you know, cans of food, anything that has weight to it, or you can use resistance bands. All right, so how often do you need to exercise? Most doctors recommend at least 30 minutes of moderate to intense exercise at least 6 days a week. If you go by the CDC, I believe they say 5 days a week at 30 minutes. And this gets brushed over a lot. I just want to make sure that that you guys have a little extra information on this. When we talk about 30 minutes to moderate or intense exercise, it's the difference of going for a walk for an hour versus going for a high intense run for 20 minutes. So the harder you work, the more you push your body, the shorter your duration, right? The slower, the more calm of an exercise regimen, the longer your duration. In the end, you will end up burning the same amount of calories. You'll be able to do the same amount of good for your body. It's just duration versus intensity. All right. So we're going to talk about some of the precautions for those specifically who are dealing with diabetes when they begin an exercise regimen. You always want to consult your doctor before beginning a new exercise regimen. You want to talk to your doctor about some of the do's and don'ts, some of the things you need to look for, some of the restrictions you might need to apply. You want to take in plenty of fluids. And as Chuck said, you want to check your blood sugar before exercising every day. And the reason is you're looking for two things. And I believe I heard Camille talking about this a little bit earlier. But if your blood sugar is below 100, then you need to eat something, preferably something carbohydrate based in order to bring it up. Because as you start to exercise, as we said with cardiovascular, you're going to lower it. You don't want to lower it to the point of hypoglycemia. If your blood sugar is above 240, it may be too high for you to exercise. And I'd heard you guys talking earlier. That's when you want to test your urine, test your ketones to see where you're at, to see if you are in ketosis. Because as Chuck had said earlier, you don't want to end up with ketoacidosis. Now, the variation in that is whether you're doing aerobic cardiovascular exercise or you're doing strength and resistance training, because one will cause your blood sugar to go down and one will cause your blood sugar to go up. So you want to make sure that you're aware of those two numbers and the fluctuation based off of the type of exercise. You want to wear cotton socks and comfortable athletic shoes. You want to really protect your feet, because with diabetes, you're more at risk of injuries and injuries not healing because of nerve damage or lack of blood flow to the nerves in the extremities. So if you get, so the next one is after exercising, inspect your feet for blister sores and cuts. So you want to make sure, because you may not feel them, you may not know they're there. So you want to make sure that you're checking your feet, you're checking to make sure that there are no cuts, blisters, or sores. And if there are, then you need to do what you need to do to treat them. If that injury, like Chuck was saying, he said he had a cut on his arm and it just wouldn't heal. And if that's the case, if after 2 days, whatever your injury is isn't healing, you want to call your healthcare provider and go on in and get checked out. And then lastly, you want to check your blood sugar after your workout to see how it's changed or affected your body. Like I said, and I can't reiterate enough, strength training is going to cause it to go up, and cardiovascular is going to cause it to go down. And that's just during. After your exercise is done, your body's going to go through some changes as well. So you really do need to keep an eye on it. At some point, your liver is going to increase that blood sugar flow. It's going to have sugar dump. So you need to be aware of your body and how it's reacting to that exercise. All right. And then we want to go ahead and list here a few of the signs that you want to watch out for. If any of these signs or symptoms come about, you want to stop exercising, call 911 immediately. We're looking for lightheadedness and dizziness, rapid heartbeat, chest discomfort, jaw, arm, and upper back discomfort, nausea, unusual shortness of breath, sudden weakness, severe and unusual fatigue or sleepiness. That's what Chuck was talking about, and severe discomfort of any time. Basically, you're looking for that significant drop in energy levels. You want to, dizziness, lightheadedness, and then again, the nerve issues. If you start to feel those, you need to call 911 and go in and get seen. All right, and then our last one is, how do you start your exercise plan? And this is going to be different for everybody. But these are a couple tips that I find are important when you get started. So you want to schedule it. You want to make it a priority in your daily routine. And I found that many people, if they get up early and they start their workout as the first thing, it helps them stay organized throughout the day, stay on track. It helps them to prioritize the rest of their day. Also, you're boosting those energy levels. You're going to feel good. But that's not a given. If it's easier for you to work out at night or on your lunch break, whenever you can find time. But if you schedule it, you'll have more of a incentive to be there to do it. Speaking of incentive, you can also find a partner, somebody that has similar goals to you, somebody that wants to work out with you and keep you accountable to your routine. And that could be a personal trainer, that could be a friend or a relative, anybody who's going to keep you on that schedule. Start small, set small goals, and ease into an exercise routine. I'm sure Chuck can probably reiterate, but when people start out with a new routine, people always tend to get a little ahead of themselves, push a little too hard and overdo it. And that drastically increases the risk of them not coming back. So you don't want to hurt. You don't want to be so exhausted that you're miserable, right? It's a long journey. So start small, start easy, and then find something that you like. Find a form of exercise that is enjoyable to you, that you don't mind doing on a regular basis. So whether that's swimming, biking, going to the gym, lifting weights, whatever you find to be enjoyable along the way, you're going to be more successful at. And I believe that was our last slide. And it was. I did also want to state, I thank you, Chuck, for your testimonial here. And I think, speaking generally as a man, we are worse than women at going to the doctor for our issues. So whether you're a man or whether there's a man in your life that you care about, if there's something that's different, if there's something that's just a little bit off, please go, or encourage them to go and get it checked out, whatever it may be. We all know that when it comes to cancer or some of these, horrifying diseases, that early detection is the best thing that you can possibly do. So if something is off, if something is different, go get checked out, take care of yourself, make sure that you take that initiative. And back to you, Camille.
Very much agree. It is, diabetes can affect both men and women, but it is more typical in men, and men don't like doctors.
No, we don't.
Typically. We do have a couple comments in the discussion that I wanted to mention real quick. Miss Bolton, I'm going to not pronounce your first name correctly. So Miss Bolton said, when you do get sick, your glucose levels tend to be all over the place. And that is why we definitely recommend testing your glucose levels. Don't avoid your medications, but make sure you're testing your glucose levels. If you need a snack, if you need to drink, make sure you do that. But make sure that you're taking your medications, and don't take anything or do anything without testing. And Miss Sarah Hare said 30 minutes a day for exercise. You don't necessarily have to do it all at once, which is also, I believe, very true. Mr. Robert would have more comments about that one.
I agree, and that's kind of where we talk about intensity versus duration. So if you've only got 20 minutes, kick it up a notch, do a HIIT program. 15 minutes, 10 minutes, it doesn't matter, as long as you are putting forth the effort. So if you've got the time and you want to go for an hour-long walk with your neighbor, that's going to be great, and you're going to fulfill your need for the day. If you've only got 10, 15 minutes, wherever you're at, hop on down and work as hard as you can for this 10, 15 minutes.
I very much agree. Does anyone have any questions that they wanted to ask either any of our speakers today? You can say them in the chat if you don't want to unmute your mic, and I'll read them.
I'm not particularly, I think it's metoprolol. If you're taking metoprolol, it masks the signs and symptoms of hypoglycemia. So if you are giving, I think it is metoprolol. Normally when their sugars start dropping, they feel the jittery, they feel the, their sugars dropping. Well, if they're taking this, I think I should have researched that. If they are taking that blood pressure medicine, they will not be feeling that. And next thing you know is you're going in there and you find a patient that's continually dropping their blood sugar, and they're not showing the jittery. Normally, diabetics do feel their sugars dropping, and they'll let you know. That's one thing that I've learned asking patients when you go in, and it's like, hey, do you know what it feels like when your sugars are dropping? That way, you sort of, if they don't know, this is a good time to educate them. This is what you're going to be feeling. This is when you need to make sure that you are eating something with that will help you with your blood sugars go up. But if they don't know, this is if they don't know or you do know, it's just an education thing. And if they do know, then you sort of know, hey, they know their body well enough to let me know, hey, I think my sugars are dropping, and it gives you an extra an eye on your patient. But there is a blood pressure medicine, and like I said, I'll put it on the comment when I Google it real quick, but that will mask the signs and symptoms of hypoglycemia.
It is a beta blocker. It's a lull. I remember it. That's another reason why you got to make sure you're testing. Even if you feel like you don't have to, you're supposed to test it every morning and then before a big meal, just to be sure that nothing's amiss. There was something else I wanted to go over just real quick. Some of the signs and symptoms of either hypo or hyperglycemia can present themselves as someone potentially being drunk. That has been a mistake many, many times with someone called out with paramedics or ERs. They say, oh, he's got really fruity alcohol breath and he's fallen over. It is possible that this person is suffering from a diabetic shock symptoms rather than being drunk. And that's something that you guys need to look out for as well. If you're seeing someone who's acting a little weird and they haven't been drinking and maybe they just got finished on a basketball course or something, you might want to look into how their blood sugars are doing. And this includes people who aren't in the nursing program, people who are just going around hanging out with their friends. If you know your friend is a diabetic, these are things you can watch out for, signs and symptoms to help take care of your friends and family that are around you. It looks like it is beta blockers in general that can cause, that can mask symptoms of hypoglycemia. Thank you very much, Ms. Bolton. Are there any other questions that we can answer for you guys while we're all here? If no one has any other questions, you can always send the Student Nurses Association Facebook a message or send it through sna.tcc@gmail.com, and we would be happy to provide you with all of the researched information that we can. With that, thank you, Mr. Chuck, for the amazing testimonial you've given us. And Mr. Robert, thank you as well for all of the wonderful fitness information. And I hope you all have a great day. The end of the semester is coming up. We just got to hold on a little longer.
Thanks, Cammy.
Thank you.
Thanks, Rob.
No problem. Thanks, everybody. Great program.
Information.